I think we are live. So,
Yes.
good evening, everyone. So, the FMG results have been recently released just a few hours back. And I am Dr. Sandeep Sharma. I am the FMG, NEET PG, and INSET faculty at DocTutorials for pediatrics. And I am joined by an achiever who was a DocTutorial student, Dr. Ashra, with us. Dr. Ashra, in her very first attempt, has scored a double century. She has got a score of 206. And it's my privilege to invite her to this interview. Congratulations, Dr. Ashra, and welcome.
Thank you so much, sir. Thank you.
Before we begin, please tell us about yourself, what place you belong to, where you did your UG from.
Yes, sir. I am Ashra. I'm from Kerala, Kochi. I did my MBBS from first 3 years. I did from Ukraine, Venezia. Then, due to war, I had to take a transfer to Russia, Northern State Medical University. I completed from Northern State Medical University.
Okay. So, Dr. Ashra, 206 is not a joke, let me tell you, in such a tough exam. What was the time you actually started preparing?
Sir, from my during my fourth year or fifth year, I started using various platforms to study.
Hmm.
But it was not a proper study. But I completed the main subjects from Russia itself. I did medicine, surgery, and gynec. I did it,
Okay.
but I was not 100% confident in it. But this 6 months I've like read it. It's like not I didn't think that just because I did it I will only revise. No, but read it
Hmm.
like
Okay.
with
So,
everyone. Yes,
so you really pressed the accelerator once you were back to India, if
yes,
I'm
yes,
correct.
yes, sure, yes.
So, what was the the resources that you utilized? How was doc tutorials useful in your preparation?
Yes, sir. DocTutorials, sir. I watched the videos and the MCQ. MCQs are really good, and the daily they put 10 questions, morning, afternoon, evening. Like I used to wait for it. Like I wanted to do it. So it's like we will, and it's like a boost of confidence. We score above 70. Like, oh, next time 80. Next time I can score. Sometimes even I scored full out of it. Then I was very confident because it's a mixed bag. Then
Yes.
at the DocTutorials GT was the same mark. I got 210 in DocTutorials GT. I got 206. I think 4 silly mistake I have done in the real exam. That's it.
Yes.
It's the same mark.
See, this is one thing I can actually boast about. People talk about
Yeah.
strike rate all the time. Let me tell you, strike rates, although my I also talk about strike rates, but they can be a bit, here and there because
Yeah, yeah.
everything is there in books and not everyone can remember. But doc tutorials GTs that we make, we try
Yeah.
to be as close as possible to the exam, and this is a testimony from Dr. Ashra also. So,
Yes,
Dr.
sir.
Ashra,
When we started doing the exam of the DocTutorials GT, it was very hard, the first 10 questions. So I was like, how will I do it? But slowly I waited. So each time the question started making sense. It
yes,
was,
and the daily dose questions we were putting, I think you were a fan of that as
yes,
well.
sir. That I have utilized that to the fullest, I think. Every
Okay, awesome.
morning, evening, everything I've done.
Okay, so who were your favorite faculties at Doc Tutorials?
Sir, I cannot emphasize enough on Rajiv Dhawan sir, Priyansh Jain sir, sir you, then Gayatri ma'am, Khalil sir, Nadeem sir, I don't know, all of them. Like,
So, do you feel that the resources we provide that is sufficient for you
sir, it's
for any
more than
FME
enough.
aspirant?
It's more than enough. We just have to revise it. We
Yes,
just have to
yes.
revise it. That's it. Revise it. Not imperfect revisions are better. That's what I feel. You have
See,
to
Doctor,
revise.
yes, please.
We have to revise it again and again. That's it. Even if you don't recall, because as Khalil sir says, it's not a theory exam. Like we don't have to actively recall it, but once we see
Okay.
the options it will click.
It will click, absolutely. So,
Yes, sir.
another thing I want to ask you, Doc, because a lot of students who are listening to you, some of them may not have done that well, and
Yeah.
some of them will be, sitting for the first time in June exam.
Yes.
5 months to go. What advice would you give, keeping in mind the way clinical exam is being asked? What suggestions you would give to the future aspirants?
Yes, sir. There is no shortcut. Like, do the hard way. Like, see the full videos. That's what my suggestion is. Because I am like a kind of person who is looking for answers. If it clicks, like once you study everything, it starts connecting from different aspects. Like, if you
Correct.
study medicine, pediatrics, a lot of it clicks. Like the chapter of pediatrics, there is a chapter for metabolic. If you study biochem, that's just like 2 minutes.
Hmm.
If you study
Correct.
microbiology, the infectious chapter of pediatrics is again a 5 minute job.
Yes.
Yes,
Yes.
so you have to, like, everything is integrated. Like, if you
Hmm.
understand, like, it's like it'll take time for us to understand how it is integrated. But if you get
Hmm.
that, like, we have to continue, then you have to understand that you're going in the right path, because that's how it is.
Hmm. Correct. Correct. So
Yes,
there was a lot of talk this year about questions being very integrated. I think integration is just a part of the journey, and if you
yes,
have
sir.
prepared all the 19 subjects conceptually, the answers become easy to
Yes, sir.
mark. What's your view on this?
Yes, sir. Like, how I did during the exam, I didn't think about any like mark or anything. I checked like if I knew around 25 questions, sure shot in 8 set. Like,
Hmm.
I wanted to be sure that 25 questions I should not go wrong. So
Hmm.
that's, sir, that's like it was like a boost for me. So next set, oh, do I know the 25? Next set, do I know the 25? I don't know if it works for everyone. And I had plenty of time. I don't know. Like, I don't overthink. If I don't know, I don't know. I don't want to spend my time on it, because it
Hmm.
will
Hmm.
waste a lot of energy. Because when I did GTs, I used to be so bothered about the thing I don't know. I was always so sad about the thing I don't know. But if you don't know, it's okay, you know. And the next question, it's like we
True.
have to push together. Like how Rajiv the one sir said, if you don't know a question, look at it and smile. Like, it's okay, we don't know.
Yes, absolutely, absolutely.
Yeah,
So,
it's okay.
you took the name of all these wonderful faculty members who are all
Yes,
my colleagues as well. So, DocTutorials are the prime aim is not to overburden the students, and we try to
yes.
give the way that you can. Did you utilize anything apart from the GTs and from the regular videos? Anything else from the
Sir, I
DocTutorials?
also the small mic questions, like small subject-wise questions, PYQs. They used to put every day. Towards the end, they used to put it so regularly. So it's like normally everybody says you have to practice 300 questions. Without us knowing, we will do that if we do all the MCQs.
Okay, nice,
And
nice.
sir, I want to say one thing. Like, when you
Yes.
practice PYQ, do PYQ of NEET PG.
Hmm.
Like NEET PG questions, I felt so similar. That's what it came for the exam. Because in FMG
Yes.
questions, that's more than FMG questions, I felt NEET PG PYQ is so similar to what came in the exam.
Yes. I think that's a basic funda a lot of students need to understand. Very
Yes,
little difference between NEET PG and FMG.
yes,
Exams are more clinical, they are more integrated. As
yes,
Dr. Ashra is saying, shortcuts will not work if you begin them in the beginning. In the last 1 month, everyone uses
yes,
shortcuts,
yes,
but
yes,
eventually, you should not be building your base upon that. And daily dose and regular videos, she was able to finish in 6 months. If she can finish in 6 months, why can't you finish in 6 months? It is doable, and she has done the unachievable 200 plus in such an exam. My suggestion, I told her before this interview also, you should not let this talent go waste. Continue with the momentum, celebrate,
yes,
but internship will take time. So
yes, sir.
a bit of
Yes,
NEET
sure,
PG, why
sir.
not? Right?
Yes.
So, in the end, Dr. Ashra, you want to, give any suggestions, any, hope to your friends and juniors and colleagues who have not done well this time? Anything you want
Sir,
to tell
like,
to?
I want to say it's achievable. Like, everybody puts a lot of hype that we cannot do it, but it's really achievable. Like, I've seen people who have hard worked for the 6 months and they've scored so good. Like, my friends, like, I'm so proud of him. That's why I want to take his name. Like, he was a normal student from Russia, but he scored 194. That is like I'm very proud of him. Like, his name is Shuhaib, and all my
Okay.
friends, like, I'm so proud of him. And like this is the moment, like our parents, seeing that in our parents' eyes, that's enough. Like we feel like we have done it. More than us,
Yes.
it's towards our parents. I want to say, like, thank you to my parents. They've always supported me for everything.
Absolutely, absolutely. End of the day,
Yeah.
this there are a few things we live for. One of them is
Yes,
bringing
sir.
smile to
Yeah.
the faces of our parents, and I'm sure your parents are really proud of you. So please
Yes,
convey
sir.
on behalf of
Like,
the entire team of Doctor Tutorials, please convey my greetings to your parents.
thank you so much.
That
Yes, sir. Sure.
we are proud of you, and I'm quite sure they are also very proud of you.
Yes, yes,
Dr.
yes.
Ashra, apart from
Yes.
your parents and your friend, who are the people you want to give a shout out?
Sir, like whole faculty members, like I don't know how to say, like, sir, everyone, like they have literally hold our hands. I felt like during the exam, it was me, my parents, God, and our faculty members together. Like, really, I am saying it from my heart. Like we were writing the exam together, and I still remember. It's all Rajiv Dhawan sir what saying. That's what I came to my mind. And Priyansh Jain sir, like how he says, just flip the page, just do that. It's enough. You will think it's
Yes,
not enough, but it's enough.
yes. Absolutely, absolutely, absolutely. So wonderful, wonderful talking and sharing all this with
Yes, sir.
you. And
Thank you.
on behalf of the entire team, I convey again the greetings to
Thank you
you.
so much,
And
sir. It
keep
means a
shining,
lot coming from you.
keep shining
Really.
bright. Take care and
Thank you so much, sir. Thank you
keep
so much.
inspiring everyone. Thank you,
Yes,
Dr.
thank you
Ashra.
so much. Thank you.